So welcome again. Thank you so much for joining us at Housing Partnership Workgroup. As you know, we hold this event a couple times a year, and we're really excited today to bring you a panel discussion with some housing providers and from New Narrative and REACH CDC. Today, Laura, our executive director, is going to be moderating that discussion. And we also have Katie Warden, our public policy coordinator here, to help with the event as well. All of you might know me. I'm Marisa Espinosa, she, her pronouns. I wanted to turn the mic over to Katie briefly, just to introduce ourselves, since she's the newest member of our advocacy team. Katie, if you don't mind saying just a couple words, and welcome.
Yeah, thanks, Marisa. Hi, everyone. I'm Katie Warden. I use she, her pronouns, and I am the public policy coordinator at NWPP. I've been here for about 6 months. It's been a whirlwind. Been awesome, though. And prior to working here, I worked at the Housing Authority of Washington County for 2.5-ish years, working on community engagement work for the Metro Affordable Housing Bond Program. So that's a little bit about me, and thanks so much for joining and looking forward to this conversation.
Great, thank you so much, Katie. All right, excited to have you all here. Just to go over the plan for today, we have a lot to cover, but we're going to make sure we wrap things up by 5 p.m. We know you're all very busy people. So we're just going to do a little bit more welcome, and then I'm going to go over a presentation about housing stability through the lens of racial equity for a while. Around 3:30, we should be starting our panel discussion with all our panelists from REACH CDC and New Narrative. And then we will have some time for folks to ask more questions of our panelists. So we're really excited to hear the questions you might be bringing on this topic today, whether they come from the discussion that's going on, some of the experiences that you've had out in the field, or anything else. So we're going to have Laura read our land acknowledgement just to get us started. If you don't mind doing that, Laura.
Not at all, and welcome everyone. Thanks again for being here. So yeah, we're going to take a moment to do this important land acknowledgement. What we now call Portland, Oregon, and Multnomah County were the traditional lands of the Multnomah, Clackamas, Cowlitz Band of Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who made their homes along the Columbia River. Today, people from these bands have become part of the Confederated Tribes of Grand Ronde, the Confederated Tribes of Siletz Indians, as well as the Chinook Nation and Cowlitz Nation in Washington State. We acknowledge the systemic policies of genocide, relocation, and assimilation that still negatively impact Indigenous and Native American families today. We also acknowledge the many other ways white supremacy and structural racism are deeply embedded into Oregon's history, including the deliberate exclusion and displacement of Black and African American communities and neighborhoods in Multnomah County.
Thank you so much, Laura. Thank you for making space for that today, everybody. All right, and then another quick housekeeping piece. A lot of this is very straightforward. You've all seen it before, but it's just a good reminder since we may be especially short on time today. If you don't get your question answered today, we can flag it for follow-up after the meeting, and I will show this email address again for you to email with any questions or concerns at all. You'll also see a survey as you're exiting the webinar. We'd really encourage you to fill that out. That helps us improve the event for everybody. And that's something you'll see in your browser when you're leaving the webinar later on. All right, so we're going to get started with this presentation here. We know that this is a big question or a big topic to discuss. We're going to try to give you a framework to think about what we're discussing today around housing stability for people exiting homelessness. How are we looking at this through the lens of racial equity? How are we addressing some of our goals to reduce racial disparities in homelessness, as we also look at the fidelity of our programs and how we're getting folks placed into housing permanently. So hopefully this presentation will help us do that. These are some of the key questions that we put together to kind of frame up this topic. We know that folks might want to hear a little bit about how racial disparities show up in systems for people exiting homelessness. We want to talk a little bit about what it means to take a closer look at housing outcomes and racial disparities, and what areas of the system that we can examine to identify and address these disparities. And so these are just a few ideas and concepts that we hope you might take away from this session. Questions you may already be wondering about or have seen come up in your work. So to get started, we're going to just do some level setting on racial disparities overall, which I know we've talked about at previous Housing Partnership Workgroup events too. Hopefully some of this will feel a little bit like a review, but it's always good to kind of go over some of this, and there may be some new things in here for some of you. Now, this information I'm about to share, we've gone over before. It comes from the National Low Income Housing Coalition and the Opportunity Starts at Home campaign. They do a really good job of narrowing down how racial disparities show up in housing due to structural racism. So due to different policies, practices, historical factors, all these things that have impacted our housing system as we see it now. And where disparities happen. So one of the first pieces there, of course, is affordability. We know that people of color are more likely than white households to be low-income renters and struggle to pay rent. Segregation is another piece. Communities of color are usually more spatially isolated in housing, disinvested in, denied equal access to amenities. That has a lot to do with deliberate policies of segregation that were for a very long time in place, and now we see de facto segregation take place, which means it's not authorized by law, but it does happen still. Quality of housing, we know that substandard housing quality is more likely to be experienced by people of color, and that obviously relates to segregation. Wealth building opportunities are limited for most people of color, and that again comes from active policies that limited home ownership to white households for a long time in the US. And then when we saw more predatory lending practices targeted at lower income households and people of color, that continued to reinforce this pattern. And then homelessness, we know that people of color are dramatically overrepresented among the population experiencing homelessness. And it's something that we see at just about every level of government. So that's what we're going to dive into next. Now, at the national level, this is one way to kind of quantify what it is we mean by racial disparities. Zooming out, this is one way to kind of take stock of where is this showing up numbers wise. So if you're saying how many people experiencing homelessness per 10,000 people in a given racial or ethnic population, you can clearly see that there is a disproportionate representation at the highest level with Native American and Pacific Islander populations, American Indian, Alaska Native folks, and Black and African American folks. And then you can see that the numbers get a lot smaller for all the other groups going from there. We can also see this when we zoom in a bit more on Oregon. This is data that was put together for a statewide task force on racial disparities and homelessness. This is another way that we see a lot more commonly, especially in our reporting at the local level, to be able to say where are the disparities in homelessness. So we're comparing the percentage of the population in Oregon to the percentage of people experiencing homelessness. And so this is kind of one of those compare the columns sort of exercises. You're comparing the total population on the left-hand side to the population experiencing homelessness on the right-hand side. You can see that for white identified households, they're actually underrepresented among the population experiencing homelessness. And then you can see among the Black population, they're actually overrepresented at 3 times the amount that they're represented in the total population. When it comes to Asian identified households, it's another underrepresentation, but with American Indian or Alaska Native households and Native Hawaiian and other Pacific Islander folks, we see that overrepresentation once again. And then we can keep on zooming in more. This is looking at Multnomah County. This is from the latest published point in time count. And we can see, again, this one is kind of an interesting visual because you're looking at where, the columns sort of step upwards to the right versus where they step downwards to the right. And where they're stepping upwards to the right, you're actually seeing an overrepresentation, and the reverse is true for when they're stepping downwards. So we actually see the most drastic overrepresentation among American Indian and Alaska Native Indigenous populations. They're represented over 5 times the amount they're actually represented in the population, which is pretty dramatic. We see that again for Black or African American households, almost 2.5 times the amount they're represented in the population. And then same for Native Hawaiian or Pacific Islander populations. And so this is kind of where we have to take a breath. Obviously, that's a lot to digest. And for many of us, this isn't a surprise. We know that we see those disparities often in our own lives or in the lives of our communities, and we may be asking why. We could go back to that first slide I was talking about where we said there's historical policies at play. There's definitely challenges that we still haven't overcome when it comes to the long-term effects of those policies within the housing system. But it's also really important to see how these disparities are also happening in adjacent systems, which many times are actually feeding the cycle of homelessness for many folks. So you can see where, when it comes to our criminal punishment system, that is a big factor for a lot of folks who experience homelessness, and Native Americans are convicted of felony drug possession at an extremely high rate compared to white Oregonians. We know that Black children are highly overrepresented in our child welfare system. And again, that has been linked to homelessness for many folks exiting that system at a very young age. So we know that these disparities are happening in other places too, and these are systems that have a whole lot to do with access and stability in housing. And so we can keep this in mind as we try to unpack what is going on, why are these disparities here, what can we do about them, both at the smaller level or at the larger system level. But we'd be remiss if we didn't talk about the overall shortage of affordable units. That's really critical to discuss because that hasn't changed. It's only sadly gotten worse over the years, just when it comes to the ability for people to access a unit that's affordable to them. This is looking at data from 2019 from the Center on Budget and Policy Priorities, where they were talking about how 75% of people who are eligible for housing assistance programs are still not getting that assistance. And so we only have a very small slice of that pie that actually gets the help that they're eligible for. One analogy that can be really useful here that we've heard in the housing world for a while, but we're kind of seeing it popularized again, which is good, is the analogy of the musical chairs. That old-fashioned game some of you might remember from a birthday party long ago, which would kind of center around a group of chairs, group of people walking around, competing to get a seat, but there's always one chair short of the number of people that are there. So that's a little bit like what we see happening with housing, only in reality, this is even worse because you're actually seeing something more like 8 people who would be competing for 2 chairs, right? So that's actually a lot more difficult. You can only imagine the chaos that would ensue there. And you can illustrate that even more if you imagine that a large number of the folks in this circle of people actually have disabilities or might not know the rules of this game, might not know how to access those very few chairs that are available. So this feels important to bring into the discussion when we talk about both disparities in housing, as well as some of the causal factors that contribute to homelessness overall. So we're going to switch gears a little bit. We're going to talk about housing outcomes. I know that's a term that we all hear discussed a lot. We're going to think a little bit more about what that looks like and what we're referring to with this topic. So this is our graphic from Community Solutions and Built for Zero. You might have heard a lot about their partnerships with local governments, especially as we all embark on the work of the Supportive Housing Services Measure. And I like this visual a lot because it's one way to just define how people flow through the system of services. Ultimately, you want people to flow out of homelessness and into housing. So that's why they're calling it outflow when somebody has a housing placement, and it's inflow when somebody comes into homelessness. But you can see that unfortunately there can be a cycle, right? So this green arrow kind of shows us that there could be far too often, especially for vulnerable residents, a circling back to inflow or back into homelessness and returning from housing specifically. We know that this can happen, and that's part of why we're here today, is to really look at that more closely and try to think about some solutions. Now, it's helpful for us to kind of have some shared terminology to discuss that. So I'm just going to kind of go through a few terms. Permanent housing placement is one that we often use, or some variation of that. And if we're thinking about how HUD defines that, we're thinking about housing without a designated length of stay, an initial lease or initial term of at least a year, where this could be subsidized or unsubsidized. Another term we use is housing retention. A lot of us have had the ability to expand our retention services on top of our placement services. And when we're trying to measure how that's going, we're often looking at a window of about 12 months, but sometimes longer than that, to say how long someone stayed in their housing and was it successful. We also talk about program exits. We talk about voluntary exits where someone left their housing in good standing. Maybe they had a new opportunity for housing that was just as suitable for them. But unfortunately, we also have involuntary exits. We know that sometimes people are formally evicted or terminated from their housing. And then we talk about returns to homelessness. So that's going back to that community solutions visual that I showed you with the green arrow. That's where you may have had that exit. And from there, instead of going into another form of housing, that person actually went back into a shelter or another living situation within the definition of homelessness. So we're just kind of using these terms to track what happens for households, and not hard and fast definitions, but hopefully they're useful for us to keep in mind today. And then we're going to talk briefly about research. This is where it kind of gets a little bit nerdy, but it's very interesting. So what we know is that over the past 20 years, there's been quite a bit of scholarship to understand and improve supportive housing programs. This is just a sampling of what's out there. But what you can see in the early 2000s is that we had some studies that were looking very carefully at housing first programs and permanent supportive housing programs, all these different initiatives that have taken place across the country and in other countries. And researchers were just really wanting to hone in on how to get better at serving people, especially those disproportionately impacted by homelessness, people with disabilities, and people of color. So in the early 2000s, you saw some studies that really highlighted how involuntary leavers, in one study, they had predominantly psychiatric diagnoses or substance use disorders. There was a study in 2009 that showed that programs where the majority of residents were white had actually greater housing stability outcomes. And another study that year that said that substance abuse and perceived supportiveness of independent living staff were significant predictors of a negative departure. So it's kind of a fancy way to say that substance abuse and how people got along with the support staff at their site made a difference in whether or not they were successful. Those were two of the factors that they saw. Then we get into the 2010s and we saw a little bit more focusing in on racial disparities. A study in Tennessee said that After controlling for selected resident characteristics, they saw that African American race was associated with a 56% increased likelihood of involuntary exits, which, as we remember, this is when somebody's evicted or asked to leave. There was a review of research that same year, and it concluded that future investigations should really take a better look at how program components relate to outcomes, especially for subpopulations based on their race or their ethnicity or their age. And then we have some more recent scholarship that really looks at some of the outcomes, especially for Black participants. So in LA in 2021, there was a really helpful study that looked at Black single adults in PSH programs and how they were exiting programs and returning to homelessness at a much higher rate than white participants. Another one that's related to this was a study around the VISPIDAT. So I know many of you are familiar with this. This is a tool that's used to place people in permanent supportive housing, to rate how vulnerable they are. Now, these researchers noted that there are real significant limitations and potential racially biased outcomes of this assessment. We know that most of our local jurisdictions are actually working to replace this tool. But even within those limitations, they were able to see that higher VISPIDAT scores were significantly associated with an increase in the odds of returning to the homelessness service system. So we can kind of extrapolate a little bit from that and say, okay, if we know that the populations disproportionately experiencing homelessness often have disabilities or people of color, people impacted by the criminal justice system. Those are the same things we're looking at when we're doing the VISPIDAT assessment, getting people into these supportive housing programs. It can be very worrying to also see that the highest scoring folks are the ones who are more likely to return to homelessness. So just to pivot again, keeping all of this in mind, we can look at Multnomah County again. We're not trying to put Multnomah County on blast here, but we are working in Multnomah County, so this is a really helpful example. And we know that we can see some of the outcomes we defined earlier. They are uneven, they are disparate, especially when it comes to who gets access to PSH in our system. And who is returning to homelessness. We saw in the fiscal year 2019-20 that the average rate of return to homelessness was 24.9%, but it was actually 28.7% for Black and African American households. Also, it was higher for American Indian and Alaska Native folks and Native Hawaiian and Pacific Islander households. So we're seeing those same patterns play out. We're seeing how they reflect the broader disparities that we talked about before. So it's not an isolated incident. It's not one specific county or system, but it's looking at how all these things are connected to the bigger picture. And we should also take a moment to think about the words of people who have participated in programs. Aside from the academic research, we know it's really critical to center lived experience. So I'm just going to briefly breeze through some of these quotes since we're a little short on time, but they kind of get at some of the potential factors that could be contributing to these uneven and disparate outcomes. This particular quote is someone saying, "We didn't have a conversation. I don't know how many people she has in her log, but if she'd just been paying attention." And this person is talking about their participation in a VASH program after being in the program and feeling as though they didn't get the amount of support they needed. Another person said something along similar lines from the same study. They said, once you get in your apartment, you're kind of on your own. So really seeing that challenge of getting the support that they need. Is there enough capacity in that program? This quote is actually from the study in LA from 2021, and you actually had a case manager pointing out how microaggressions, especially towards Black residents, were really a big part of why residents would leave and look for different housing. And this person said specifically that Black residents would get sick of dealing with a difficult manager or the microaggressions that they're building. This last quote is very powerful. Oops. Hopefully you can still see my screen. This one is a little bit more specific to one person's experience. They're talking about how they are perceived by staff. So they're saying, you know, they're prejudiced, they don't know how to talk to you. We're seen as drug addicts, we're seen as mental, we're lazy. This is a Black resident who is really looking at how these systemic factors have come to play a role in how service provision is treating them and how they get viewed by the service providers in their living environment and what that means for them. So,
Marisa, sorry to interrupt. We had a question in the chat.
yeah.
Eve asked, is this only for adult populations or including teenager homelessness? It was back a couple.
Okay, so the studies that I was talking about included mostly adult populations. I came across studies that were talking about youth, but I don't think I included any of those in this review. So this was much more focused on adults, whether they're single adults, or if some of them might have been families, but they tended to be single adults and veterans.
Thank you.
Yeah, no problem. And hopefully you all can see everything on my screen. Okay, I think I had a little issue, but we'll just keep going. So yeah, when we're looking at these potential factors, which should hopefully translate to other populations as well, just to kind of break them out a little bit so that it's a bit easier to digest, we know that it could be level of service provision that is impacting how someone does in the system, the client themselves, what are their needs, what's their level of vulnerability, whether we're looking at it through the lens of the VSPDAT or not. There could be issues with program and system design, or the quality of the housing, or the quality availability of service. We also know that a big key piece that a lot of our organizations are working on is how to directly address racism and trauma, whether it's systemic racism, interpersonal racism, creating a trauma-informed environment. We know that all those things can be really crucial in creating an environment for people to be successful. And of course, program policies and practices. And I'm sure you can all think of a few others that you've seen in your work, but these are just a few for us to kind of chew on for a little bit and think about. So I'm going to quickly breeze through the last bit here because I want to set up our conversation with our panelists. So this is just going to kind of get us a little bit oriented. Obviously, as I mentioned, program design is one of the factors that we do have control over. That is one of the pieces that we spend a whole lot of time thinking about or reflecting on as we actually provide services in housing. These are just a few examples of ways that these programs can be configured, because obviously there are different entities involved. This is obviously just talking about what we see when we have our finished product, which is a housing project, and we have our services on site. This doesn't even take into account the developers and all the others that are involved in creating a supportive housing project. But once it's there, we know that you can have some projects where you would have a couple different entities doing different roles. So you would have maybe an owner manager, but a separate entity doing site support, like resident services. And then you would have community-based organizations bringing in referrals for case management and that sort of thing. Or maybe it's an owner that also does the resident services on their own, and the property manager is from a third party or private company. And then another one you might see is where it's all different entities. It could be a different owner, separate property manager, separate site support staff, and maybe they're getting their referrals from the network of community-based providers. So hopefully this kind of jogs your recollection, or maybe it just makes you think of the project you work for. But I know there's a lot of sites in our community that look in these different ways or configured in all these different ways. And another piece that we can talk a little bit about is just the variation in roles when we do divide out support services versus property management. We know that support service staff, for example, in the case of a rent payment, is going to be more looking at offering assistance to tenants and service referrals, whereas property management is actually collecting that rent, addressing rent arrears. Again, when it comes to addressing behaviors or violations of the lease, your property manager is going to be actually issuing those violations and enforcing lease terms. And then, there's some overlap maybe where it comes to addressing physical and mental crises. You're going to have both of these entities play a role in that, especially in community building. That's another one where a lot of collaboration can take place. But then, of course, if we were looking at safety and security, we would see some more delineated roles on who's conducting inspections, who's addressing issues versus who's notifying property management of hazards or issues. And this comes from the Corporation for Supportive Housing. This is just sort of adapted from some of the framework that they put together. So I really recommend taking a look at that, which brings me to our list of resources. So we have this here, which I'll be sending out with the slides. You'll have all the links here for more exploration of this topic. There's some of the stuff I referred to, and I do recommend the episode for the Understanding Homelessness podcast. They actually interview some of the researchers who did the LA study on racial disparities in PSH in Los Angeles. And that's produced by our partners at Portland State University at the HVAC Center. So we're really encourage you to check that out. It's a audio podcast for you to listen to. Alrighty, so I am gonna stop sharing for just a moment here.
All right, well, thank you. Thank you, all of you, for being here. I just want to give a really, really brief introduction of each of our panelists so that we know who they are, a little bit about their background. First, the folks from New Narrative, William Allen. He's the VP of Operations. Thank you, William, for being here. He guides and develops the operational team and infrastructure and develops affordable housing opportunities. He's worked in behavioral health and nonprofit sector for 16 years with a variety of organizations. So really solid background there, Will, thank you. And Julia Hare is the Director of Property Management at New Narrative and oversees the work of Horizon Property Management there, and that supports a variety of affordable and supportive housing projects. She brings 13 years of experience, way to go. And then Iris Sexton is the VP of Residential Services at New Narrative. And in that role, she supports residential treatment programs where participants receive personalized care and support, I think a key aspect of New Narrative's services. And she was previously an intake clinician for New Narrative and has been working in this sector for 17 years. So thank you to the New Narrative team. And then to our friends from REACH, Regina Amadeus, the Manager of Compliance over at REACH CDC, and she oversees compliance for 2,000 units of affordable housing, including tax credit in Section 8 and HUD properties. She's been involved in this work for 14 years and is a great advocate as well for low-income vulnerable clients. Thanks so much for being here, Regina. And hi, Megan. Megan's the Interim Director of Programs for REACH and oversees resident service and community builders teams who have a trauma-informed approach to supporting residents and homeowners in housing stability. And she's been in this work for 20 years. So thank you, Megan, for being here. Thank you, Iris, William, and Julia. Really wonderful to have all of you here. And I think one of the reasons that we were so interested in particularly hearing from you all at REACH and New Narrative is because of the specific work that you're doing at that intersection of housing and direct service and client support. And it's like having a foot in each world, and many of us don't have that experience. So I think it's both fascinating, interesting, and lots of lessons that we could learn from. So thank you for being here. And I think to frame up sort of the environment in which you're working, you know, we all of us collectively in Multnomah County know that about 4,000 people are being permanently housed from homelessness each year, and that the supportive housing services measure brought significant dollars to expand all of the services throughout the county and throughout our tri-county area, helping more and more people access housing, new housing, and access those important supportive services. And so all of you have been thinking really strategically about how to make sure that people are getting the support they need to make that transition from homelessness to housing and to remain housed. So to that end, we wanted to open up with this question. What are the main obstacles that people who recently exited homelessness face in permanent housing? And Iris, I wanted to start with you on that and ask if you could describe some of the health needs, the social needs, and other needs that you've noticed among residents who recently exited homelessness.
Yeah, I think there are a lot of needs folks have. And I think as we are supporting folks in getting housed, we often think, great, we'll get the housing and then things will be great. And things are much better, but it does not solve all of the obstacles that folks are facing, especially in light of some of that racial disparity information we just learned more about too. And I think the area that I think we see it loudest sometimes is the social needs of somebody. Right, that folks have been in houselessness. Now they're living in a place with neighbors. They are permanently there, and that can be stressful. I think what overlies really all the things that we'll be talking about today too is the impact of trauma, and that folks who have been houseless have experienced a lot of trauma, either from their time specifically being houseless or from the other systems that they've been involved with as well, and that those trauma impacts show up in a lot of different ways. Some of those are being activated by people you're living next door to. Some of those are being activated by staff who are attempting to support and coming from strangers, right? And people don't have that trust built up yet. And so a lot of the social needs that we see is how do we live near people? And we can't just pack up and leave because this is now home. And how do we work through some of those challenges? And so I think that it's part of the needs and is often the most loud need that we see with having staff on site and navigating those challenges for folks. I don't know how much you want me to go on. I could keep going on. That's a big question. The other people want to chime in more too, but
it is a big question. Yeah, thank you. Thank you. No, I think you touched on that point about why it's difficult for residents who are new to housing, moving from homelessness. I wonder maybe for a little bit more, if you could just add a little bit more about the medical and behavioral health needs and how that impacts it.
Yeah, well, I think too, so when you don't have a place that is stable to live, a lot of those other needs aren't being met and addressed, right? Your survival is your primary need. Now you have a place to live, and now there are all these other needs that we're able to notice and pay attention to too, right? If you're houseless, people aren't keeping an eye on you. Now we have staff on site saying, oh my goodness, this person has this challenge. We should get them to a doctor. And then trying to figure out where do we actually have access to primary care resources? How do we support this person with a history of trauma, trusting us to connect them to a primary care doctor and then actually go and get that service as well. We also know that racial inequities exist in the medical health field as well as ours. So I think for some folks, it's the first time, maybe in a very long time, maybe in their entire adult lifetime, that they've really had the time and attention on these medical needs that have been gone untreated without that preventative care.
Great. Thank you. Thank you, Iris. Megan, I want to turn to you to maybe amplify a little bit of this issue of, you know, the challenges that people face when they're newly housed, but also to really ask you to focus in on the way that racial disparities play a role in homelessness and how that impacts new residents and the challenges that they have. Are there ways that some groups are more vulnerable and have a more challenging time in getting the services that they need or connecting with services once they've gotten into housing?
Yeah, I mean, I think so. I mean, I think Iris touched on a lot of the things there, but I think some of that is the trauma past and the lack of trust, as well as then just, you know, some of the services we're connecting them to. They're not going to be able to see anybody. They're not culturally specific services. There might be some there, but they're isn't enough, right? And like, okay, great, let's find you a doctor. Oh, look, that might be someone great. Oh, they're not accepting new patients, or there's a 3-month wait, like the first intake appointment isn't for 3 months, and then you're going to get set up with services like that. And then that's 3 months, which, you know, does sometimes feel like it goes by really fast, but when they're new to everything and you know, like getting someone to 3 months later, that could be 3 years later for all we know, you know? So I think that's a big part of it. I think it's also just they're moving into a new community and they don't know us and we don't know them. And so, you know, I think there is sometimes where there's warm handoffs that happen with the case manager, and those are amazing, but those don't always get to happen. I think the other piece is we run housing and it's got a lease that's got, Regina would know better, but it's got a lot of pages that people have to sign with a lot of legal language that is overwhelming for me. And I have to read a lot of things, and there's a lot, you know, like, and I think, so we're asking people to do all these things and not putting a lot of supports around them, as we're just like, yeah, great, you have housing, but then there's all these other pieces. So, you know, and I don't feel great about just being like, just sign it. Like, and I think especially for folks that have had a lot of trauma in their past or terrible situations in the past with something where they signed something and then 2 months later they find out something else awful happened. Like there's that piece of it too, but we need them to sign a lease. So like there's these system norms that have to happen, and we don't account for a better way to make that happen. I mean, we try to, but it can't always happen because we still need them to sign a lease.
Great. Thank you, Megan. I think that flows well into sort of this next area of questions that we want to talk about why it matters that we prevent negative housing outcomes. And, you know, we've got a goal. Again, we're talking about Multnomah County of housing 5,000 people and more people across the region. And we know that supporting new residents to stay in their housing is the goal, but that can be difficult. I mean, obviously there's some challenges that you talked about. So to get a little better picture of what's going on when these placements happen, what happens when residents aren't successful in permanent housing? And so Regina, I wanna look to you, and then Julia, have you amplify after Regina on this. What does it look like when a resident is unstable? What are some of the early challenges? And, you know, things like, what does the manager see? What does the building staff see? What do other residents see and or say? Regina?
I was looking for my mute button, realized I had unmuted it already. So I think one of the things that we see when someone starts to, like Megan said, you know, our residents are on a lease, and even though we try to have this really warm handoff with case management with someone moving into housing, it's, you know, regardless of how in-depth that case management is and how supportive and how many supportive services someone might have wrapped around them, that person is the one on that rental agreement with property management. And most of the time, at least in our housing, not only are they on a lease, but it's also tax credit housing or Section 8 housing or HUD housing. And so there's all these other additional bureaucratic hurdles that someone has to go through in order to get into housing. And then once in housing, right? So that's the first step is, okay, you made it through the screening and you made it through the income eligibility piece, and now you're in housing. And what happens after that is, in some ways, it's up to the resident, right? They're ultimately the ones on the lease and kind of expected, just on paper, right? They're expected to kind of follow the rules and regulations, but we know that we have a lot of people moving in who have high needs and often have kind of need a higher level of support than property management can provide or that resident services can provide. And so we often rely, I mean, we hope that we can rely kind of heavily sometimes on case management if someone starts to have a mental health crisis, or it's clear that they're having physical challenges where they do really need to be connected to, to more supports, to a doctor, to primary care, to, other sources of treatment. And, our site staff is really limited with what they can do to connect that person to that care. And so it's really difficult for the site staff when we're in that position, because, they're trying to say, okay, who is this person's case manager when they moved in? Oftentimes, just like site staff, case management is stretched incredibly thin, and they have clients all over the Portland metro area at a bunch of different properties, and no one can be on call 24/7. So, and, the site staff has a responsibility to everybody at the buildings. And so when we do see a resident who is starting to kind of reach a crisis point or need a higher level of care, our first, the first direction, it kind of starts with property management and resident services, and then reaching out to case management, and if possible, connecting them to whatever care we can outside of housing to help keep them stable, with the goal obviously always being of eviction prevention and keeping people housed. But, it's not always possible. And, we do our best to, train staff in de-escalation and crisis intervention. But, if you're working in a building with 100 households, and one or two residents need that higher, or multiple residents need that higher level of care than we can provide, it can be really, it gets to be really challenging. And I don't really always have the answers. It's something we talk about all the time in housing is, we always need more. We always talk about how there's this great need for housing, right? We need units, but we also need services on top of that, because we have so many people who getting into housing is the first hurdle, and then staying housed is the next one. And we have a lot of residents who just need a higher level of care than our staff can provide. And so then, and the agencies that we rely on to provide that additional care are also stretched really thin and kind of at capacity.
Great, thank you. Julia, I'd love to hear your perspective on this. What does it look like when somebody is unstable, and, what are the early signs? What are the things that people say or do?
Yeah, so this question really kind of leads me back to that quote that you shared earlier about as soon as somebody gets into their apartment, they're on their own. And I think what that really translates to in property management world and case management world is that there is that disconnect in alignment of missions. And so anytime you put somebody that needs any sort of supportive housing, you can have these great case managers. But as soon as you put them in a property that is conventionally managed, you do lose that sense of mission-driven, day to day. So when property managers are not aligned with their values and goals, that's when we really start seeing some symptoms of that disconnect with tenants, because most of these residents, it's great. We find a place for them, they get moved in, but that need for service does not end there. And it does not end only with case management. Property managers are just not trained to the level or even to trauma like other caseworkers are. So they have no idea how to identify symptoms, how to address symptoms, and not to mention conventional property management. It's a for-profit world. It's not a world that thinks about sustainability, social equity, community development, or even long-term goals for that particular individual. And that's when we really start seeing a huge disconnect that ultimately impacts the resident. So when we do start seeing those symptoms where they're not, the residents are lacking basic skills training because they've been homeless for a long periods of time. They don't understand things like your conventional renter would. So when we as property managers, as conventional property managers start seeing those symptoms, our typical approach is to go off the rule book. Resident did this, violation letter. Resident did this now, violation letter. So it's a system that is ultimately going to lead to eviction. there is nothing in between that to identify, is this particular individual symptomatic of something? There is no integration between conventional property management and case managers. There is little of that. And so unfortunately, that disalignment is what ultimately leads to the resident suffering.
Such a heartbreaking situation. But I want to just ask further, Julia. So have you and maybe Will, you can chime in on this as well. Have you at New Narrative started taking a different approach and sort of responding to situations in a different way instead of taking the rule book out and say, you know, violation, violation? What other strategies have you encountered that work? Or maybe the gaps that are the things that are missing that we heard from Regina and Iris and Megan that don't allow an alternative approach?
Yeah, so I can share a little bit, and Will, feel free to chime in. But our approach, our vision, and our mission is to create long-term stable housing. And I think that automatically aligns with almost any organization out there in Multnomah County and Washington County that is there to support these residents. So that is number one. We are usually mission aligned 100% of the way. So therefore, we want to keep this resident in there as long as possible. So our policies are built to work with the residents and the case managers before we start giving out violation letters, before we start filing for eviction. We understand that a lot of times when there's issues going on with the residents, we can't take a conventional approach. This is not a conventional tenant in this unit. So a conventional approach is not going to work. So our policies are structured in a way that are meant to keep people in long term. They are meant for us to be integrated with the case workers, case managers, and other program managers. And they're also meant to be interactive with the tenant. So we can have discussions, we can address what could potentially be causing symptomatic concerns or behaviors, damages to the unit. And so we really are aligned to have these conversations before it leads to essentially tarnishing their rental history even more and them ending back out on the street.
Thanks, Julia. Will, I don't know if you wanted to add to that at all.
Yeah, just a little bit, like just kind of doubling down on some of it. And that, like for us, when we created internal property management, and I'm kind of jumping a little bit ahead here, maybe in some of the questioning, but it relates directly to that question and kind of what Julia was speaking to, is that I kind of think about it from like a philosophical alignment, like at 100,000 foot level, which is that like if property management has the same alignment as every other service provider that's at that housing site, right? Like whether it's a peer team, a clinical team, residential services, a medical team, whatever that is, then like those teams like shifting into alignment and starting to realize that it's actually a single services team and property management is a part of that team, right? The difference is that every team has different boundaries and different responsibilities within that different spectrum, but they all kind of have some overlap. And that when I think about kind of some of the, I mean, you know, in some of my experience, some of the adversarial like relationships that can develop between those teams, of like if all the teams can know that, hey, we're property management starting out from a standpoint that is aligned in a mission-based way, that does want to see housing retention, wants to see thriving communities, then like all the things that flow from that, policies and procedures, the culture of the teams, the way we communicate with each other, the way we resource each other when there's crises on site or when we need to get a referral out to some type of specialist provider to get someone's unmet needs, that you'll see a lot more alignment and kind of to Julia's point, like you'll see a lot more of those needs getting met, and a lot less, you know, like there's a whole set of barriers that can come up between those teams in terms of their communication styles, as well as like how they align and whether they view each other as just two different teams that are showing up at this site to do their job, or if they view themselves as a single unit that's striving towards the same goal. So.
Great, thanks, Will. And just sort of a follow-up to that, given that approach where you're describing a single team, what does that look like for you when you think about the long-term outcomes for many of these residents who are coming in from homelessness and who have challenges. You know, so what does your model offer in terms of the long-term outcomes that are maybe different than the traditional model?
Yeah, well, I guess the way I think about it is, and you know, like my background, I'm kind of coming from a social work perspective, and that's what I kind of brought to like property management when I first started getting involved with it. And it's kind of thinking about how, like, right, there's so many barriers for people to get into housing and to stay in housing. And that, especially if you take property management law as a really black and white concept and apply it without any nuance or flexibility or discussion, you're going to have so many opportunities for someone who's just coming into housing, who, you know, some of the stuff that Iris and Megan touched on earlier, like there's all these new adjustments. And so there's so many more opportunities when you take that approach for people to fall back out of housing. And I think that, like, from our approach, the standpoint is kind of like what that looks like on the ground is like really like strong relationships between like the property management team and the other teams that are working at the site. That can be like team building and, you know, and getting to know people and like getting like advice, but it can also be things like running group supervision together, like, which is kind of a classic social work model, right? Or that, like, you know, especially on our sites where we've got a lot going on, it's weekly meetings and checking in with people. But it's not just around like it's more important than just like, here's the checklist of items we're going through. It's that, like, I've got a real relationship with the other people across the table, and I believe in their integrity and that they're aligned with me, and that how I'm coming to the site to support these people. And so I think that, like, when you get to that point, you know, you start to, like, the teams become a really collaborative effort of, hey, property manager was on site today. I noticed that, it kind of to your question earlier, like, I noticed that someone was like, they were really worked up. There was like this thing that, you know, maybe to us seems kind of minor, but they're like, they're really going about this. And, you know, in my head, I'm thinking, this person has been traumatized. They're worried they're going to lose their housing. They think any excuse could be used against them, right? And that person's like, oh, hey, I'm going to tap my other fellow team members on the shoulder to start working this together. And you know, and some of those things, like to what Regina said earlier, like, okay, maybe that's not directly in a property manager's sphere, but like at least we train people around being like, hey, understand what the referral sources are, and like equip and resource them to work with these types of people who have like really complex needs, so we can really seamlessly pass like those needs like in between the team in the most efficient way possible. And this idea that, like, you know, utilizing things like reasonable accommodations and policy modifications, like when appropriate, in a way that's pretty consensus based between the teams to like make sure that people can stay in their housing. And I think that the long-term outcome is probably twofold. First, like, you do have less evictions and people stay in housing. I think for me, it's also like, when as a property manager, you're doing all of that stuff, it's not just showing the other teams you work with they can trust you and that you're actually showing up with good faith, but showing the tenants that too, right? Like, they start to be like, oh, like, I wouldn't be surprised if lots of people come in and they're like, I'm really afraid of property managers because they have an incredible amount of power over me. They can take my housing away, right? It's a scary concept. And if you've had some bad experiences, just write them all off, right? And I think that for us, we try to spend a lot of time building relationships with people. Like, a small one that goes a really long way is like when it comes to reasonable modifications and accommodations, we have this entire like binder that we just give to tenants and their service providers if they're external. We're like, we have like pre-written letter templates. We will like walk them through the process of how to do it. And like, even just that commitment to doing that shows people like, hey, I'm not like gonna just, you know, blow you off on this one, or I'm not gonna like try to hide away all like the papers that are your rights for you to kind of ask for this thing of me that you're legally guaranteed. So, and I think that leads to a thriving community where people like actually want to live and they're not living in fear.
Oh my goodness, that is so awesome. The work that you all are doing is, oh man, it is so good to have you all in our community doing this work and really being so solution oriented and creating better outcomes for really the most vulnerable people in our community. It's wonderful, wonderful. And thank you, Will, for teeing up our solutions section, because you highlighted some of those. And to your point, you know, all of us are working in this work for better outcomes for people, permanent, stable, dignified housing that they can afford. So I want to go back to Regina and Megan and just ask you what some of your service approaches have been that you've seen working for clients, and how do you fold that in to the overall picture on the management side? So I don't know who wants to start there, maybe Megan. you can start with that.
Yeah, I feel like, well, you just set us up here for this though. Because I think that that single team philosophy, we call them site teams. So it's the site team has consistent meetings, at least weekly, depending on the size of the building. I think the one thing that we do that I really appreciate is that we also have our maintenance team and any building monitors at that meeting also. I think that a reality of sometimes who sees something maybe going astray or not doing so great versus maintenance. They're the ones that are in people's units first, or more often than everyone else. Like my faucet isn't working or my toilet's running. Like they're the person going into that unit and seeing like, hey, this, I was in there a couple months ago and now I'm in there now. And so just really, and I appreciate, Will, how you said that, like really valuing everybody's thoughts and where their philosophy is and getting everyone together to have a collaborative approach. I think that's where we try to take it, is like, and I might know someone better than somebody else. So there's this thing going on. We have to talk to someone about it. Like, who's the best person for that? That it might be resident services, but it might not always be resident services. And so trying to figure that out, because things are going to come up that we want to address. And so I think that team collaboration, I think, is really important for us. I also think the thing that we try to do is figure out different and creative ways to build the community up. That's a piece of it too, is we want our buildings to be in good condition and like have everything, just because someone doesn't have a lot of money doesn't mean they should live in something that doesn't look great. We want them to care about it just as much as we do, but we also want people to have some fun and wonderful things. So if it's movie nights or potlucks or, we can we're back to doing those things. And some of our spaces have some great outdoor and inside community space to do some community building. Just because I think that piece, one of those quotes is like, I wish my HUD-VASH case manager had spent more time with me. And it's like, we know everybody is stretched thin, but here's some time to get to know each other or to just be in this space with other people and approach it in whatever way people want to. So I think that's something that we try to do, and have the site team, have people, have us all step away from behind the desk, so they can see the property manager is the one who's, they had a breakfast the other day and the assistant property manager was apparently making everybody made to go omelets. Like, so you see the property manager in a different perspective than just the person who you hand the rent to, or is the person that is having to give you a notice. So just trying to build those different kinds of relationships with people, because everybody's had different relationships in their life. And, we just want to keep that going. We're part of their life now, and recognizing that we're a piece of, sometimes a piece of their family. Especially we have folks that live at our building, they can live at our building forever, so, and some of them do. And recognizing that, showing appreciation for that, like they're part of our community. So I think that's something that's really important for us.
Great.
And then
Megan.
I was just getting to feed into Regina. I think Regina and her team just keeping us for us to helping us do those compliance things in a way that we have to do them, but making them easier especially for those of us, I'm a service person and I know that we have to do compliance, but having the support of the other team to hey, let's do this together. Let's we can all get through this together, instead of this oh, we have the dreaded inspections, or oh, this dreaded whatever, so I feel like we're lucky that we have these teams that all want to do this together.
Yeah, and to that point, Regina, how on the compliance side, where there's a lot of policies, a lot of procedures, how do you build the values that Megan is highlighting into those policies so that they're they live and breathe the values as opposed to the rule?
Well, sometimes, unfortunately, sometimes, to be totally honest, my job is kind of the professional wet blanket, which is, but both when it comes to talking to staff and with residents, one of my big beliefs with compliance, having been doing this for so long, and it's compliance is really critical, right? It's critical for our funding. It's critical for us to be able to get new projects. And there's all these annual reporting and quarterly reporting requirements that we have, and we have to report on tenant data and tenant incomes. And for someone to get into housing, there's so many hurdles. And I believe in just really explaining, right? Because so much of what we do on the compliance end, I didn't make these rules, right? We have to, but it's nobody likes being told, just sign this, or you have to, just do this paperwork, just fill it out, just sign here, right? I really try to explain to the staff, we do a lot of regular trainings, and we're starting to do more like where we explain the whys of what we're doing. Like, this is where the money for this property has come from. This is why we have to verify your income. This is why we have to do this paperwork. And for what we have to do, the annual recertification process that we have to do, which is a source of anxiety for a lot of residents, because they think, oh my God, well, yeah, I was below the income limit at move-in, but now 2 years later, I got a better job. And are they going to make me go because I'm making too much money? And 99% of the time, no, they don't have to go, right? Most of the time, once you're qualified, in most of our housing, you're always qualified. And with Section 8, it's a little different, but no one ever loses their housing because they got a job. It never happens, right? But a lot of people, because they've had so much trauma in their history, getting into housing, losing housing, we really try to, make it clear to people that no, a big part of these housing programs are that the goal is that you do better once you're stable. And because there's a lot of anxiety around those annual recertifications, we call them recert parties. And we, if it's a morning event, we have donuts and coffee. Residents get notices letting them know, hey, recertification party, you're due, come on down. Some residents just come by and get snacks and hang out, or they go, like if they're not due for their annual paperwork. And if it's a big project, if it's a big property and there's a lot of people who've got to do paperwork at the same time, we'll get managers and staff from other sites to come and help. So it's a community building for us because we're hanging out with coworkers we don't always see. But it's also like in the community room, and there's food and there's snacks, and like residents can see, okay, like this is not scary. My neighbor's in here. We're filling out this paperwork. We're all doing this. And then we all get to go home, and, no one's housing is in jeopardy. This is just a part of the process of living in this kind of housing. And I think that, those have been, we've seen a lot of success with that, with just being transparent about, this is this annual thing we've got to do. And, just giving people, answering people's questions and being honest about the process. And a lot of people on, the compliance end and the rule enforcement end, we have a tendency to just say, just do this. It just needs to get done. And I think that's what, that's frustrating and traumatic for people. And, there's a reason why we have to do everything we do. And so there's no reason, and it's not secret. So let's just, give people that information and, make it as enjoyable as possible.
Great, thank you. Oh, there is so much here and so much more to talk about. Being aware of our time, I wanted to let maybe Will, you can take the lead on this one, but Iris and Julia chime in. We'd like to hear more about, and Julia mentioned this, about and you mentioned it too a little bit, Will, the new model you've been developing around mission-based property management. And give us a little background and insight into the conversations. You touched on this a little bit, Will, but let's crack that open a little bit more, and hear a little bit more about how you got to where you are, and then tell us a little bit more about how the residents have been impacted with this new approach.
Yeah. So I started working for New Narrative 7.5 years ago. It's been a while. And in my first kind of year and a half, one of the things I was tasked with doing that we started talking about internally was what the situation was at our housing sites in our housing continuum. And in particular, like the relationship with property management. We had an external commercial property manager, and I was kind of asked to like, hey, go evaluate this and tell us what you think. And so I just went out and started kind of hitting the pavement and just interviewing staff members at all the different sites and kind of what was going well, wasn't going well, and what were the details around that. And I talked to the property managers themselves, and I talked to residents. And it's just kind of been somewhat covered throughout these different pieces, but what really came back was that there was this just total disconnect between the property manager and the services as well as the tenants, and that there was a lot of things that were happening that, I mean, again, I don't think any of them were malicious, but there's certain, you know, at the end of the day, it's like, what's our impact is always what you think about, regardless of our intent. And there was a lot of policies and procedures and things that were happening that were re-traumatizing people. Some of them particularly gregarious around like just how much they were affecting people, like giving people, you know, evictions notices by accident, things like that. And it, you know, stuff that can be really traumatic for people and destabilizing. And so we kind of looked at it and was like, okay, what do we think is going to make the most sense? And again, coming back to it, like the realization when we looked at all of it together was, unless we have kind of control of the property management side of things, and we have that mission and value and culture alignment between those different teams, it's going to be hard to guarantee that we can make this better. And, you know, I'm going to be straight, like, as most people know, it wasn't cheaper to bring it in-house, right? That definitely cost us more money. And I think from the perspective of the lower staff turnover at sites, the lower resident in unit turnover, higher occupancy, and then really, frankly, most importantly, just people staying in housing and actually enjoying where they're living and living, you know, thriving lives, that was going to pay off for us more. And so we brought it in-house and started managing it ourselves, because under Oregon law, if it's your own portfolio, you can self-manage it. And so I don't know if it's in this current version of it, but we created the policy handbook from scratch. And I think on the first page, it actually says like the intention of this policy handbook is to like give direction, be in compliance, and to keep people in housing and meet this mission. And all of the way we looked at like how we wrote our policies, like when we looked at all the different gray areas within the laws, and a lot of it came back just from feedback from residents as well as staff members around where areas that are needlessly high barrier or needlessly evicting people, or, you know, or at least not being proactive anyways, and trying to find solutions that can work for everyone. And so we actually got a lot of input from those teams. And when we went through the different versions of the policies, we actually had them comment on them. Like we were like, hey, let's review this. Let's sit down with the peer and the clinical teams and see what they think. And they were pointing out stuff, you know, that was getting past us even about like, hey, there's different ways to think about doing some of these items. And again, that's kind of resulted in our approach now is like, as we refine that over the years, and we've just built this super strong integrated structure where the property management team is like, you know, they're friends with all of the teams on the sites. Like they know people, like they've worked with them for years. They know the tenants and residents. A lot of the stuff that Regina's talking about, like we do a lot of things to like humanize the property management relationship. If we think that we've got a site where that's kind of falling out, then we'll put office hours there and people will deliberately be there open door or go around talking to people and just, you know, lingering is the term we use sometimes, just you know what you do when you see someone in a hallway and chat with them. Yeah, is that kind of answering that initial part of that question?
The mute button, absolutely. Well, thank you very much. We are good on time, so I want to back up a little bit and just maybe Iris, you could just speak to the challenges around, or the role of healthcare and other systems impacting how we support clients. We talked about this a little bit earlier, but it'd be nice to hear a little bit more about that, especially in your model at New Narrative.
Yes. And I also want to piggyback on what Will was saying before we dive into that.
Okay,
too.
good.
Just because I think part of it is this all sounds really great right now. We have some great successes and we're doing really good work. And I just want to acknowledge that it isn't easy. And we can't just say it's going to happen and it happens. We can't just say we have mission-based property management and we have this great team. You all go sit in this room and it all works out. So I really just want to call out that it takes really hard and intentional work to do this. And all of this, somebody put in the comments too, that the relationship matters, but you can only do this if you have relationship and trust. And I think Will and I have had some very intentional conversations with our teams over the past year too, that, you know, what mission-based property management has looked like has evolved over time since when he started this project 7+ years ago, that it's not a set it and forget it. Like we tried one thing, we have feedback, our teams evolve, our resident population evolves as well, and that we're constantly getting feedback and adapting policies and procedures and relationships too. So I think that that's a really big part of it, it's dynamic. And the issues that we see now, post-COVID too, are different than some of the issues we saw pre-COVID. And that the needs of our residents are really just becoming more and more complicated. We also have an aging population, which is bringing up, again, more of this medical side. So just really wanting to emphasize that it sounds really great right now. We have a lot of successes, and it's only because of the work we're investing. And it's still a process that's evolving and unfolding too. And I think an area where we are continuing to work is how do we partner with the other supports for a resident's life that are external to our teams as well. And that is, quite frankly, still ongoing work. I think too, sometimes we have referrers who are the ongoing service provider, but they get someone in housing and then they tend to go worry about the rest of their 100-person caseload and what they're going to do. And now we have a resident who's, like, I'm here, but I still need help, and figuring out how resident services can bolster that and work on those linkages as well. So I think part of it is also clarifying like what we are actually able to provide and where we need more support and reinforcements, or that different piece of the puzzle. Because physical health care is still an area that there's a huge need and a gap there, I think, in our ability to really help someone be successful. I think I also wanted to share a story real quick, because we haven't done story sharing, and I feel like we have a story that can kind of highlight we have many stories, but and just thinking about what Julia has been talking about and how this team actually works. One situation we had fairly recently, we have a newer property. So there was a contractor there doing some work. We had a new resident who had just moved in, and we got a report that this resident was making a verbal threat to this contractor on site, leading that person to feel very unsafe. And it quickly could have become a really unfortunate situation for that resident too, if we did not have property management who are understanding and really wanting to maintain that person's housing. But given the team that we had, within minutes of hearing about this event, we had the residential services, the residents' clinical team, Julia and her team, both Will and I were instantly in email communication, getting more context and figuring out what was actually going on and understanding this resident's experience. Someone who went from houselessness to immediately housed, there's someone on a ladder outside your unit. This is all very unusual. How can we support this human being? And I think if we had been with a regular for-profit property manager at a site without staff on site, that would have been really easy to have an unfortunate outcome for that person. But we were able to figure out a safety plan for everyone. That resident got the support they needed. The contractor was able to figure out how to finish their work in a safe manner too. And it just worked. And it was amazing to see like the communication go so quickly, with really everyone feeling that they were on the same team. Like, how can we both address the needs of the community right now at this site, as well as the needs of this human being? So just wanted to share that, because I feel like sometimes those stories kind of helps highlight this.
Awesome. And I wonder, Regina and Megan, do you have a story that you want to share?
Megan? I'm trying to think of, like, I was like, that was a really good one. I think, I think for us, just some of those same pieces of the having people talk to each other, we unfortunately at one of our properties, there was a domestic violence situation going on, and those are obviously, there's a lot of different pieces to those situations, but the property manager, resident services, and maintenance had all been in touch about, like, the person was actually ready to kind of take the other person, the abuser, off the lease, and walking through those steps and talking to the whole team about it. And just, I think that communication that Iris talked about is that key piece, that people know each other, and to know, like, hey, they're calling me, I should probably answer, because they don't usually call, they usually email, like those kinds of things, just to get those quick responses that I think residents see that, they see that we are responding, they see that we're hearing them, and that those actions speak really loudly. So I think that's a piece that we take really seriously.
Great. Julia, I wonder, I want to zoom out again and really talk about our housing outcomes, and all of us together working, to keep people housed, but housing providers in particular taking a different approach to evictions when all options have been exhausted, what are some other alternatives? So Julia, from your perspective, what resources would you need or would be needed for you and your team to tailor an approach to property management that is really, really focused on resident support? You've touched on that a little bit, but are there resources that you're missing that you would like to have? It's been, you're still developing this.
Yeah, definitely. So one of the things that I wanted to share is that kind of what sets mission-based property management apart in just a really impactful way is that, like Will shared, a lot of our policies and procedures are written around what are the long-term goals for this community, for the residents of this community, for this particular person's needs, where a lot of conventional property managers write their policies based on the P&L sheet. Mm-hmm. What is actually going to generate income versus what's actually going to keep people in-house. So I think for us, in terms of being able to continue to offer these services or to expand these services, we really need to be able to have funding to staff sites, to have on-site staffing. We need to be able to offer technical assistance and training for other nonprofits that are maybe doing their own in-house property management, or that are even interested in knowing how to approach a conventional property manager when they have a particular client. So, but technical assistance, having more materials, and continuing to collaborate with other agencies to share resources. So, I mean, that could be even just expanding beyond Multnomah County or Washington County and really partnering with other areas. So, and awesome. I think to some extent, it's also to create a standard approach, even statewide. I mean, that's obviously a bigger topic, but I saw something in the chat and I completely agree. Maybe conventional property management is not the right type of management that should be going into places that are being funded in any way by state or federal agencies. Maybe there should be a requirement that the property managers are trained, maybe have a special sort of certification, something like that, because it's just not going to work. There's a huge disconnect with missions, and it's not working.
And great point. Thank you so much. I wonder, Regina, from your perspective, what sort of resources would you need to really be able to build out tailored approaches?
Yeah, well, I guess kind of going back to what Iris was saying about kind of what, even, we're a mission-based housing developer and provider as well, but we hit our limits with, as far as like when we have residents who, we don't have on-site case management. We've got property management, we have resident services, we rely, we work very closely with external agencies, but we have a lot of residents who are aging in place. They have a lot of physical needs, and when they, even with reasonable accommodations, oftentimes they still, they reach a point where they need a higher level of care than we can provide, but there's nowhere else for a lot of people to go where they can afford to live and where they want to live. So that's something that we see really often, where we know that, we can't provide all of the services and support that some of our residents might need, but they don't have any other options or places to go. To answer to your question, it's a systemic problem with affordable housing and services, because it is problematic that there's so many for-profit companies managing affordable properties, right? But a lot of nonprofits, maybe they develop the housing, but they don't have the capacity to have their own in-house property management. And so they outsource it to for-profit third-party management companies that don't have that mission component. And, until there is, there would have to be a, federal or state requirement that that gets built into an affordable housing agreement. Similar, Julia mentioned that a lot of companies, for a lot of companies, it all comes down to the profit and loss. And even on our end, as a nonprofit affordable housing development and management company, we have to answer to our asset management teams when we have a new property that's, we're getting tax credits for, and we're getting funding for, and we're trying to fill in the funding gap so that we can build this new property. We've got, there's insurance, and there's investors, and there's the for-profit banks that are, investing in this housing because they get tax credit kickbacks, for investing. That's the whole tax credit program is, big pocket, for-profit investors can give back to their community by investing in tax credit housing, and they partner with a nonprofit developer, which is REACH. And, we build the housing, we manage the housing. But we have to show that the property can cash flow, and we have to show that the property can support operations for the next 30 plus years. So, if we want to keep rents, if we would like to keep rents, below the max that we can charge, because we know that, the golden ratio for rent is about 30% of somebody's income. And we know that even at our reduced rents, a lot of people are rent burdened moving in. So we want to keep rents lower. But, on the underwriting side and the bank side, they're looking at these properties saying, well, you only want to charge 600, but you could get 800 for these units. So, we need to see that this building can sustain operations for the next 30 years. So there's all these other stakeholders that are a part of this. And so I feel like in order for some of these changes to happen, like in order for there to be like more supportive services, like baked into these new affordable housing properties, and in order for there to be some kind of guarantee that there be like a mission-driven component and, service certifications and training for staff, I mean, it has to come from a higher level. Like it has to come from, the state or the federal level to kind of integrate this into affordable housing. And it really seems like for years, I mean, the talk has been, we need more affordable housing, we need more units, but we need services just as much as we need units. And I think finally, like when you watch the local news and the national news, like services are getting talked about a lot more. So, maybe 20 years from now, finally, there'll be some like, federal initiative that, some bill that kind of builds this, that changes affordable housing a bit. But yeah, I agree. We need more services, and we need more understanding of how important a mission-based focus is when providing this. It's not just about building the housing and moving people in. It's about giving them the support once they're housed to stay housed.
Great, thanks, Regina. One more quick question for Will, because you sort of covered this, Regina. What sort of advocacy effort would you like to see, Will, that maybe would be a partnership or that could take place or has begun? Regina mentioned maybe a federal bill or something, but do you see any advocacy efforts that would build out, support your work?
Yeah, well, we're kind of engaged in some right now. I agree with Regina that, sans a federal declaration of some type or state bill, coming through, which I want to be clear, even if that did happen, right? Like, it's not like kind of to Iris's point, there's a lot of work here. You wouldn't like just be standing up a bunch of mission-based property management places overnight. I think that for me, I tend to look at complex problems and want to bring a lot of different solutions to them. And I think that like one of the ones we're involved in right now is how can we offer technical assistance, not only to other nonprofits, but frankly to other commercial property managers as well. Like how can we help enhance them and like support their staff and try to, pass along some of these tools, because, at the end of the day, I do think it's in their best interest, right? Like I think it's going to make it less stressful for their staff members. They're also, if you're going to look at it from a profit and loss standpoint, in theory, you should have lower occupancy and less turnover at your sites, right? So I think like having more resources to like spread these ideas and offer them, for like right now, like we're kind of doing things like this panel and stuff, but to do it in a more systemic way, especially throughout the metro area. And I'm kind of focusing on like the Oregon side of things. And then I really got to double down on what Regina said about services. Like my perspective on housing in Oregon is more cash than ever in the history of the state has been pumped in to the capital construction of units in the last 5 years. And That's great. Like we need that, no doubt. And to Iris's point earlier, just having people go into housing is not the end of the story. And it's not the end of the solution to that issue. And that having services, like even the best like mission-based property management service for people with really complex needs, that's not going to be enough. Right. Like, and actually, in my opinion, it's almost unethical to run that, like, to be like, hey, we're going to refer people into this site that have incredibly complex needs, and then we're going to specifically understaff it. And I don't mean like someone's intentionally doing that, but the system, the way the laws have been written, that's what's going to happen. That's the outcome. And I do think like the supportive housing services dollars that you were talking about earlier are really helping that. I would just advocate that, like, the continuing investment in that, because I think what I continue to see, particularly with some of our partners like REACH and SEPA and other people, is like, sorry, Community Partners for Affordable Housing, is kind of like, hey, we're standing up these units online. They have permanent supportive housing units, and then like the amount of funding to have services on site is very minimal. And I would almost not even call them true permanent supportive housing, right? Because there's not enough actual wraparound services for the level of complexity that people have. So I think that's probably my two angles, is getting more advocacy and like, funding from the state and county levels around supporting everyone in the system, and trying to give supports also to those commercial property managers, since they are still a part of this environment. And then also really just, yeah, the services piece is so crucial.
Great. Thank you all. Thank you, but don't go away. We've got a couple questions, might have some more. So thank you, Will, Regina, Iris, Megan, and Julia. I am going to just start with the first. We've got two questions right now, but as I said, we'll have more. So this question: what happens when a resident household income does go above the required area median income? If a resident was approved at 60% AMI at the time of applying, once they're found to be above 60% during recertification, and maybe Regina, this is something that you could address, are they expected to find housing elsewhere if there's still a need for affordable housing?
Well, first off, it depends on the housing that they're in. So if they're in housing that has like subsidy, they're in a project-based Section 8 unit, or a unit that is otherwise where they're getting rent assistance based on their income, their ability to get rent assistance could definitely change as their income goes up. But if we're talking about a low-income housing tax credit unit, which is kind of one of the most, I guess, common in terms of like higher volume, like unit housing, if someone moves in, they're below 60%, 2 years later, they're above 60%, that's fine, right? The expectation is you move into housing, income goes up over time. Generally, like what I have seen, I mean, probably in my time doing this, I've probably seen like 3 households where there was like intentional, like what turned out to be like intentional, they kept information from us that would have impacted their eligibility at move-in. So, because what really matters is in that first window after you've moved in, like were you income eligible at move-in? And then was there anything that would have impacted your eligibility at move-in had we known about it or verified it? So if I move in and I qualify, and 2 months later, holy smokes, I get this better job, right? I didn't know about that at move-in. There was no way that I could have anticipated that. So at my first annual recert, management's going to verify I had job A at move-in, got job B a few months later. They'll verify that there wasn't, overlap during that initial qualifying period. So most of the time it's okay, like most of the time it's fine. But I can't say that all the time it would be okay, because it really does depend on like the funding at the building, because there are funding sources that say once you exceed the limit, you have to move. And I can at least say at REACH, then in those rare cases when that happens, our first course of action isn't to say, okay, here's an eviction notice, you got to go. It's more like, okay, where are there other places where you might qualify, where we could transfer you or move you? But, most of the time there's allowances for, the expectation is that you're not going to stay at the level you were at the time you moved in. So I know it's kind of a vague answer, but most of the time from my experience, unless there was something that would have impacted their eligibility at move-in, most of the time it's okay.
Got it. Anyone from the new narrative team want to address that, the sort of change in income and impact on eligibility? Regina covered it.
Yeah, I mean, yeah, it's basically, yeah, that's the same answer I
Awesome.
would give.
Yep.
Yeah, way to go, Regina. All right, then we have another question from Jessica. She works with clients who have housing choice vouchers, and they tend to help housing clients in homes that don't have a supportive housing model. How can I, as a case manager, promote this model with companies who are notice happy, great term, other than a reasonable accommodation?
I would say,
yeah. Go ahead, Julie.
Just someone that comes from the conventional property management world. Really, the reasonable accommodation requests are going to be one of your best friends and tools to make that happen. Most conventional property managers do have really specific policies, and the only time that they can really go outside or even consider things outside of those policies are going to be in the form of requesting reasonable accommodations requests. So I think really kind of continuing to get education on how to best write reasonable accommodation requests, and maybe even taking it a step further and actually really understanding that company's policies and procedures would be the best way to address that. I mean, my other suggestion would be to have a conversation, but I also know that your typical conventional property manager is not going to go out of their way to have this really kind of sit down conversation with you, understand your program, understand, you know, the acuity of your tenants that you're working with. They're likely not going to go that extra step. And to be fair, they are very limited because they do have to follow fair housing laws. So they're not having this conversation with everyone. So it probably would be a little bit against their policies and procedures to go out of their way and have it with one particular individual. So I would say to keep it fair, it would just be sticking with the reasonable accommodation requests.
Great. Thank you, Julia. That wraps, oh, wait, here's a follow-up to that. What examples of things would be considered for reasonable accommodation in conventional housing? Julia, do you want to answer that?
Yeah, so I can tell you probably one of the number one things that I see reasonable accommodations for the most in conventional housing is reasonable accommodations when an applicant is denied for housing, especially somebody that is coming from a background of being homeless, having some sort of drug addiction, mental health. They likely, it's possible that they might have something on their criminal background, you know, that was just a result of maybe some symptoms they were having or something they were going through. A lot of times things like that are what are causing people to get denied. And I see the reasonable accommodations coming in that form a lot. And that's something that I would like to see there be just a bigger opportunity for that in conventional housing, because I think it's really important to take into consideration what that tenant was going through at the time when maybe this criminal issue came about. So I would say a reasonable accommodation for changing an approval or denial for somebody that applies. And also, I think one of the things to also consider as a reasonable accommodation in conventional housing is the actual eviction notices. Was the act actually intentional, or is this a result of a symptom that this person is experiencing? So I think that's really important in conventional housing to consider, because I have been in many situations where conventionally we should have evicted the tenant because of the behavior that they were displaying, but I knew that this was a symptom. This was a result of something that they were going through. And it could be something as simple as maybe they live in an SRO, and maybe that's not the right place for them to be at. Maybe they need to be in a single family unit. maybe being an SRO is just not going to work for them. So those are things that I think should be considered reasonable accommodations in conventional housing.
Great. Thank you, Julia. Regina, I saw your hand go up. Did you want to amplify?
Yeah, I would just, I'm so glad Julia brought up the denials, right? Because that's one thing that REACH has worked very hard on in the last few years, is lowering the barriers of our screening criteria to really focus on, to not just deny for every conviction, not just deny for, all rental history that might be negative, right? To really look at what matters for the purposes of housing. Many folks here might already know, but under the FAIR ordinance in Oregon or in Portland, one of the pieces of that is, I think it's also state law too, but are individualized assessments. So if you have a client who you are working to get into housing and they have a criminal record, they have, or a poor rental history, like, that they have things that are most likely going to get them denied at a conventional housing provider or a property management company, I would strongly urge everyone to front load with that application, that supporting documentation. Don't submit the application, get the denial, request an appeal. Like at that very first point, when you hand that application and the screening fee over, also turn in that supporting documentation. So if you're a case manager, help, write them the letter of support. If they have certificates of rent well or program completion, whatever it is that person's been doing, submit that with that application, because it generally triggers a review of all of that alongside their application, and can hopefully, if the company is kind of on their game and is kind of aware of kind of these new changes, then hopefully that will kind of streamline, the process a bit, and hopefully get the person housed a bit quicker. But don't wait for the denial. Turn everything in if you can. Submit what you can with the application so that it's there from the beginning.
Thank you, Regina. That is really good advice. Okay, we have time for one more question. Nicole says, I work in a mixed PSH program, and I'm wondering if there's a process to move non-PSH participants in the same building into PSH services program to stop the homeless cycle in their tracks. So I wonder if any of you have had sort of that experience. Megan.
A little bit. We have some PSH that we do at one of our buildings in North Portland. We partner with Urban League, and while the PSH is designated to 30 units, like that's how it started, is those 30 units, right? But we've been working with them to expand that, of just like after we got everyone moved in and not totally situated, but at least a little bit. What other offerings could they have? What could we do? Like, is there things that we could share or split or whatever, just because we noticed that they had some services that we didn't have. And so I think we're looking to do PSH in another building and hoping to do that. I think, Will said it earlier, like you get PSH, but it doesn't cover you have these wonderful pictures of what you want PSH to be, but you don't get all the funding to do that. So you do have to, ideally, at this point, we're trying to partner with who we can, and we would love to be able to offer that, because it doesn't feel great to be like, nope, this can only 30 people can have this. Like that doesn't go well in any building, not just a PSH building. So trying to figure that out. So we've definitely tried to do that. I think there's just some natural limitations that the program might have, but we try to look at like, can we at least start this way, or what could we add? What else can we bring to have it be kind of all encompassing?
Great. Thank you. Thank you so much. And I just want to acknowledge, Leslie, PSH is permanent supportive housing. Thank you for asking that, and acknowledge Kristen Cedar's point in the chat about sometimes things come up on the background checks. So you don't want to front load before you've seen that. So thank you. Thank you. That is the end of our Q&A. I'm going to hand it back to Marisa to close us out.
Thank you so much, Laura. And thank you to all of our panelists for being here. This was just such an amazing conversation. Thank you to our attendees. I know that today is such a beautiful day outside, so I really appreciate you being here with us for this important conversation. I hope you all came away with some new insights. I'd love to hear any of your additional questions if you think of them after the event. And just one quick plug to remind people to fill out the post-meeting survey that should pop up in your browser as you're exiting the event. But again, thank you so much, and a virtual round of applause to our friends at REACH CDC and New Narrative for bringing their expertise. Thank you so much for being here today.